Hi YouTube, this is Siggy here from Fat2fit2. I'm very excited today. I don't know if you can tell, but I came home and I said I have to make a video right now. Firstly, I had my appointment with the surgeon today at Kaiser, and it was 3 o'clock, and I got there a little bit ahead of time. And they took me in. The nurse was really nice. She took my weight and my height and my blood pressure. And thank God that my blood pressure was okay. I mean, my weight, it fluctuates so much. Yesterday it was 267. And today when I got on the scale it was 271. So I gained 4 pounds overnight. Yeah, I did have some snacks last night, I'm not going to lie. But 4 pounds? Jeez, that's a lot. So anyways, I met with, I'm so sorry. I met with the resident who was there, who was working, who was working with the doctor. And I'm not going to say his name because I respect people's privacy and that's confidential information. But so I met with the resident who was there. She went to UC San Diego Medical School, and I asked her, because my niece is going to medical school, how are the other UCs, and she says that they're all really good. So that alleviated some, uncertainty for me and for my sister. So that was positive. And the doctor came in, and he's in his 30s, and he's really good looking, and he's very handsome. He's tall, dark, like black and pepper hair, which I love. And he's done 1,500 of these surgeries already. And he went the extra year to perform bariatric surgery up in Sacramento. And and so I asked him why he chose bariatric surgery, and he said he wanted to get more experience working with laparoscopic instruments. So I guess he likes working with high-tech stuff. Who doesn't, you know? So I came with a list of questions. He answered all my questions. We had a very honest conversation, and we were hemming and hawing about vertical sleeve versus the gastric bypass. And because I'm diabetic, everybody says do the gastric bypass. But this is what he said to me. He said, this is just going to knock your socks off. He said that because I take some antidepressants for my depression, he's concerned about that because he has a couple of patients that had the gastric bypass and got very, very depressed. So depressed that he went into surgery and reversed the gastric bypass procedure. I was under the impression that all these surgeries are permanent and they're not reversible. But this doctor, this surgeon, has done 2 reversals, which I am sure are not easy to do. So that takes a lot of skill. So I think this doctor that I'm with is the senior on the staff, and he created the bariatric program at Kaiser in West LA. So I think I'm with the best one. So I think that was just luck, just luck. So things are kind of going well for me. Things are working out. And he said, I want you to lose like another 5 to 10 pounds, which is not like you have to lose 30 pounds. So I think that's doable. I'm going to really try. And I got this wonderful folder with all this information. Here it is. And I'm just going to briefly read the headings. So, preparing for your anesthesia and surgery, what to do the week before your surgery, what to do the day before, what you do on the day, keeping you safe, your surgical team, your operating room and recovery room experience, the waiting experience for your family and friends, and returning home. So I have all this information, and it's just easy and organized, and I love it. So my friend who took the class with me, Her surgery date is March 6th, and I'm like right after her. So they said March, maybe April, but I'm hoping it's going to be March because that would just be great. And so I am so excited. I'm like short of breath because I'm like so excited. And I'm also very excited that my son, my oldest son, I should have some water with me. My oldest son got into a PhD program in mathematics, and he has gotten a fellowship of $28,000 a year for 4 years. And he wants to study math analysis, which is theoretical, and most of the students want to study applied mathematics so they can apply it to different situations. It's a 5-year program. He's 22 now. He'll be 28, God willing, if he finishes it in 5, and let's say if it takes him 6, he'll be 29. And I think he will be living in my house until he's, I don't know how old. So I'm just hoping that his work becomes so dominant in his life that he might want to be closer to it, and this way get a place near the university. But if that's too far in the future, I'm not going to think about that. So right now I'm thinking about drinking lots of fluids, getting ready for my surgery. I'm very excited about it. I think this is going to really, really help me. And I know this is a tool, and I understand that you can gain all the way back plus more, but I can't go there. I won't go there. So I just have to work on my schedule and turn things around. But, you know, when you're taking a lot of antidepressants, it kind of makes you a little depressed. It kind of makes you, I don't know, it's hard to explain. And I'm sure antidepressants cause weight gain as well. So hopefully in time they're going to start taking away some of my medication instead of giving me more. And they said that aside from my diabetes, my hypothyroidism, my high blood pressure, and cholesterol, they said I was a pretty healthy candidate. And they said everybody that goes in there usually has those conditions. And half of the patients are diabetic that he does surgery on. So this is just like unbelievable. I just left there. I was so excited. I felt like I am really doing something for me, and this is the time. Now is the time. I have room in my life for doing this and dedicating it to weight loss and then keeping it off. That's going to be the hard part, for sure. So aside from my son getting to a PhD program, which is great, and my other son is at Berkeley, and he's a freshman, and he's doing really well. Life is looking pretty good. I mean, it could always be better, but it could always be worse. And then I asked about the skin issue, and he said, look, you know, you're not going to look the way you did when you were 22, okay, because you're at an older age. So he says, if you have loose skin, that's a good thing. That means you lost a lot of fat. And if I have to do procedure to do a tummy tuck or whatever you call it, the pedicure, whatever that is, then if I get to that place, and I'll do it. But I'm not going to worry about it now, even though it's kind of in the back of my mind. So what can I say? I'm going to be a VSGer, and I'm going to be sitting on the bench very soon. So I'm just, oh my God, I'm so excited. And it's very hot here today. It was like 80 degrees in Los Angeles. Okay, hope everyone is well, and I'm sorry the video is so long, but I couldn't help myself. Talk to you later. Bye-bye.